Hello everyone. So today we'll be learning about the cervical vertebrae.
Here are the 7 cervical vertebrae. Out of these, the first, second and the 7 cervical vertebrae, they have some distinct characteristic features for which they are known as the atypical cervical vertebrae. The vertebra number 3, 4, 5 and 6, they have similar characteristic features and hence they are known as the typical cervical vertebrae. So we'll start our discussion with typical cervical vertebrae. So here is a typical cervical vertebrae. As you can see, it has a short body or small body which is oval transversely, and on both sides of the body you can see these raised lip-like structures. Raised lip-like structures, these are known as the uncal processes. The superior surface of the body, as we can see, it is concave. It is concave superiorly, and on both sides the uncal processes, they will articulate with the lower surface of the vertebra above it to form the oncovertebral joints, which is a type of synovial joint. The inferior surface of the body, it is saddle shaped, and we can see on both sides it has beveled margins. This is for the attachment of the uncal processes of the lower vertebra to this. The bodies of two adjacent vertebrae, they attach to each other by the secondary cartilaginous joint present between the two bodies. In the center it is known as the nucleus pulposus, and in the periphery it is consisting of the annulus fibrosus. The vertebral foramen, as we can see, is large and nearly triangular in shape. This large vertebral foramen accommodates the cervical enlargement of the spinal cord. The pedicles, they arise from the posterolateral aspect of the vertebral body. They move backwards and laterally. Arising from the body midway, they form two notches, one on the superior surface of the pedicle, the superior vertebral notch, and other the inferior notch. The lamina are long, narrow, and they are directed backwards and medially. The lamina of one cervical vertebrae is attached with the lamina of the other cervical vertebrae by means of ligamentum flava. So here we can see these are two adjacent vertebrae, and the lamina will be attached together. This gap will be attached by the ligamentum flava. Both lamina, they then converge and form the spine, which is short, directed downwards. Here you can see the spine of the vertebra, which is short and is directed slightly downwards. The spine of the typical cervical vertebra is bifid. The main attachment on the spine is ligamentum nuchae and also other extensor muscles of the neck. These are the articular facets. On the superior side, they are known as the superior articular facets, and the superior articular facet, they are flat, project upwards and backwards. On the inferior surface, we can see the articular facets, which is the inferior articular facet. It is flat, downward and projecting forwards. These facets of adjacent vertebrae, they articulate with each other to form the plain synovial joints, and they allow various movements such as flexion, extension and some degree of rotation. Now moving on to the transverse process. As we can see, the transverse process is directed laterally and forward. Present in the transverse process is the typical characteristic feature of the cervical vertebra, which is the foramen transversarium. The structures that pass through the foramen transversarium are the vertebral artery, vein, and sympathetic plexus of the nerve. Further, we can see that the transverse process is consisting of the anterior root, the anterior tubercle, the posterior root, the posterior tubercle, and in between the two tubercles, this is known as the costotransverse bar. Here, this is the costotransverse bar. Now, important thing to note here is that the true transverse element of the typical cervical vertebrae is the posterior root, whereas the anterior root, the anterior tubercle, the costotransverse bar, and the posterior tubercle, they form the costal element or the costal component of the transverse process. Now here on comparing the sixth typical cervical vertebra or the sixth cervical vertebra with the fourth cervical vertebra, we can see that the anterior tubercle is much more pronounced and can be seen projecting anteriorly. This is known as the carotid tubercle, as the carotid artery can be compressed against it by applying pressure. The ventral rami of the corresponding spinal nerve, that is the spine, if this is the fourth vertebra, then the spinal nerve number 4 will be passing over the superior vertebral groove and then descends and passes over the costotransverse bar. Here we can see groove on the costotransverse bar. So this groove here, it accommodates the ventral rami of the corresponding spinal nerve. Now moving to the attachments of the typical cervical vertebra. The anterior longitudinal ligament and posterior longitudinal ligament, they are found covering the anterior and posterior surface of the body. Now on each side of the anterior longitudinal ligament, there is the insertion origin of the vertical plate of the longus colli muscle. So the anterior longitudinal ligament is attached to the anterior surface of the body of the vertebra. On each side, there is the attachment of vertical plate of the longus colli muscle. Now the upper border and the lower parts of the anterior surface of the lamina. So here is the lamina and here is the upper border and the lower part. So these are attached to the ligamentum flare. Now moving to the anterior tubercle. This gives origin to the scalenus anterior, the longus capitis and oblique part of the longus colli. The posterior tubercle is giving origin to the muscles scalenus medius, scalenus posterior, levator scapulae, and other muscles like spinous cervicis, longissimus cervicis, and iliocostalis cervicis have also attachments at the posterior tubercle. Now coming to the spine, it gives origin to deep muscles of the back of the neck. These are the interspinalis, the semispinalis thoracis and cervicis, the spinalis cervicis and multifidus. So repeating again, the anterior tubercle will be giving origin to the muscles scalenus anterior, longus capitis and oblique part of the longus colli, whereas the posterior tubercle will be giving attachment to scalenus medius, scalenus posterior, levator scapulae, and other muscles like the spinous cervicis, longissimus cervicis, and iliocostalis cervicis. The spine gives origin to deep muscles of the back of the neck, which is the interspinalis, semispinalis thoracis and cervicis, the spinalis cervicis, and the multifidus. Groove on the costotransverse bar here, as I had said, it is going to accommodate the ventral rami of the corresponding spinal nerve. So let's continue our discussion and move to discussion of the atypical vertebrae. This you can see is the first cervical vertebrae, which is also known as the atlas. It is named after the mythological character or the Greek mythology character Atlas, who used to carry the globe on his shoulders. So just like that, we can see that the superior articular facets of the atlas, they are going to articulate. Here we can see this is the base of the skull, and these are the occipital condyles. So they will articulate with the superior articulating facets of the atlas vertebra. So here you can see. So this is the attachment, and over this the skull can move, giving rise to the nodding movement. So this joint, which the superior articular facet forms with the occipital condyles, is an ellipsoid variety of joint or ellipsoid type of synovial joint, and it is biaxial. So it helps in nodding movement as well as the side to side movement of the head. Other features are this bone, the first cervical vertebrae or atlas. It is ring shaped in structure and it does not have a body, and also we can see there is no spine. So we can say that there are two arches, the anterior arch which is small and the large posterior arch. Then we can see the presence of two large lateral masses. These are present on both sides, right and the left lateral masses, and projecting laterally from the lateral mass are the transverse processes. These are the transverse processes. The anterior arch, it is marked by the median anterior tubercle. The posterior surface of the anterior arch, as you can see, the posterior surface of the anterior arch, it has an oval facet here. This oval facet, it is going to articulate with the dens or the odontoid process of the C2, that is the second cervical vertebra, which is also known as the axis. Here we can have a, as you can see, this is the C2 or second cervical vertebra or axis, and this is the odontoid process. So this odontoid process is going to articulate with this posterior articular facet, or the articular facet present on the posterior surface of the anterior arch of the atlas bone. This joint, it is a pivot type of joint and is uniaxial. This allows the free movement of the atlas over the axis. So this type of movement, this is helpful in the saying no movements. Now coming to the posterior arch. The posterior arch is much larger than the anterior arch. The upper surface of the posterior arch is marked by a groove. Here you can see the upper surface of the posterior arch. Here it is marked by a groove which is just posterior to the lateral mass. This groove, it lodges the third part of the vertebral artery. The vertebral artery, which moves from C6 upwards till the C1 and travels through the foramen transversarium of the cervical vertebra. It comes out from the foramen transversarium of C1 and then moves through this groove and then enters to the skull base. And in between the vertebral artery and the posterior arch lies the first cervical nerve. Now each of the lateral mass, it shows the following features. The upper surface, it is having the superior articular facet. This facet, it is elongated and moves forwards and medially. As you can see, it is oval, deeply concave and moves forwards and medially. The lower surface is marked by the inferior articular facets. These facets, as you can see, they are nearly circular. More or less, they are flat and also they are directed backwards, downwards and medially. Here you can appreciate better. It is backwards, downwards and medially. The transverse process, it projects laterally from the lateral mass. It is unusually long and it can be felt on the surface of the neck between the angle of the mandible and the mastoid process. So here we can see this is the base of the skull and this is the atlas vertebra, and if we attach it to the occipital condyles, then we can see here that between the mastoid and the angle of the mandible lies the transverse process of the atlas. Alright, so on applying deep pressure on this region, we can feel the transverse process of the atlas. This transverse process, it also has some muscular attachments. The deep muscles of the neck, they are attached to this transverse process and hence they act as lever. Along with its attachment, this long transverse process, it acts as the lever for the side-to-side movement of the atlas with the skull above it over the second cervical vertebrae or the axis. Another striking feature of the atlas vertebrae is that the tip of the transverse process here, it is the posterior tubercle, and the bony fragment, which is the bony part which you can see in front of the foramen transversarium, it is the costotransverse bar. There is no distinct anterior root and anterior tubercle. Now coming to the attachments of the first cervical vertebra. The anterior tubercle, it provides attachment to the anterior longitudinal ligaments. It provides insertion on each side to the upper oblique part of the longus colli muscle. So here will be the attachment of the anterior longitudinal ligament, and on both sides of this will be the upper oblique part of the longus colli. The upper border of the anterior arch, it provides attachment for the anterior atlanto-occipital membrane, and the lower border of the anterior arch, it provides attachment to the atlantoaxial membrane. The posterior tubercle, it provides attachment to ligamentum nuchae in the medial plane, and it gives origin to the rectus capitis posterior minor on each side. Behind the groove, the upper border of the posterior arch, it gives attachment to the posterior atlanto-occipital membrane. So here we can see the groove, and behind this groove, the posterior arch. This gives attachment to the posterior atlanto-occipital membrane. Now here, this is the lower border of the posterior arch. This provides attachment to the highest pair of the ligamentum flava. The tubercles which are present here, if you can see, these are the tubercles. These are present on the medial side of the lateral mass. They give attachment to a ligament here, which is known as the transverse ligament of the atlas. It is like this. This bridge between the two tubercles, it forms a ring. So this will form a ring inside which the odontoid process is placed. So here will be the odontoid process, and this will be your transverse ligament of the atlas. So this ligament, it holds the dens or the odontoid process in its place and prevents it from injuring the spinal cord. Here we can see I have attached the atlas to the occipital condyles, and this space between the atlas and the base of the occipital bone, this is covered by the anterior atlanto-occipital membrane. Similarly, on the posterior side, this space between the atlas and the occiput, it is covered by the posterior atlanto-occipital membrane. And here from the posterior aspect of the atlas and to the axis, this gap, this will be filled by the atlantoaxial membrane. Now, the different muscles that are attached to the transverse process of the atlas, which provide the movement, which provide for the movement of the atlas along with the skull, are the rectus capitis lateralis, the superior oblique, which are present here on the superior surface. The inferior oblique is present at the tip, and slips of spinous cervicis, levator scapulae, scalenus medius, they attach to the lower surface of the lateral aspect. So here is the lower surface of the lateral aspect. So again I repeat, the muscles attached to the transverse process. These are on the upper surface rectus capitis lateralis and superior oblique. On the tip is the inferior oblique, and on the lower surface lateral aspect are the slips of spinous cervicis, levator scapulae, scalenus medius. Now the transverse process of atlas, in front of it, that is, it is related anteriorly to the internal jugular vein, and at the tip here passing the spinal accessory nerve and occipital artery, which are then covered by the parotid gland. Now deep pressure, as we had seen, deep pressure between the mastoid process and the angle of mandible can lead to palpation of the transverse process. So continuing with our discussion about cervical vertebrae, we now move to the second cervical vertebra, which is known as the axis. It is also an atypical vertebra, and it has three characteristic distinguishing features, which are the odontoid process or the dens, which projects upwards from the body of the axis. Large, nearly circular, weight-bearing superior articular facets and a massive bifid spine. Here we can see the bifid part, but from the second to sixth vertebra, cervical vertebra, we have a characteristic bifid spine. This odontoid process, it serves as the axis around which the atlas bone will be rotating. So here we can see this arrangement, pivot joint formed between the dens and the ring formed by the anterior arch anteriorly, the transverse ligament of atlas posteriorly, and on both sides by the lateral mass. So this dens will be present inside this ring, and it will act as the axis around which the atlas will rotate. The apex of the dens or the odontoid process, it is attached to the anterior margin of the foramen magnum, which is present at the base of the skull, by the apical ligament, and on both sides of the apical ligament arises a pair of alar ligaments which move from this point and attach to the lateral margin of the foramen magnum. So if we look at the base of the skull, so this is the foramen magnum, and attaching to this anterior margin will be the apical ligament, and to the lateral margin will be the attachment of the alar ligaments. The superior articular facets, they are massive, weight bearing, and can be seen overhanging over the transverse foramen. Also, the transverse process is small compared to other vertebrae. These superior articular facets, they lie in a plane anterior to the inferior articular facets. The spine, it is massive and bifid. Though here we can't see the bifid spine, but mostly the second to sixth cervical vertebra, they have bifid spine. This gives attachment to the ligamentum nuchae. In addition to the ligamentum nuchae, there are 5 pairs of muscles attached to it. These are the rectus capitis posterior major, the oblique capitis inferior, semispinalis cervicis, multifidus, and the rotators. Now, the upward extent of these deep extensor muscles, all these muscles which are attached to the spine, these are extensor muscles of the neck, deep muscles. Now, the extent of these muscles is arrested at this point, that is the spine of the second cervical vertebra, as a result of which the atlas lying over the axis has very less attachments and hence is freely movable over the axis. Now the other attachments of the lamina, body and transverse process, they are same as the typical cervical vertebra. Now moving on to the third and the final the atypical vertebra is the seventh cervical vertebra. Now it is also known as the vertebra prominens because of its characteristic long and long spine. The tip of the spine can be felt on the skin at the lower end of the nuchal furrow. So this spine, it is thick, long, and if we see laterally, it is nearly horizontal, and it ends in a tubercle. As we had seen that the cervical vertebrae from number 2 to 6, they have bifid spine, but the 7th cervical vertebra, it doesn't end in a bifid spine but forms a tubercle in the end. Now the foramen transversarium, they are small and often, as we can see here, they may duplicate or even they are absent in some cases. Now coming to the attachments of the 7th cervical vertebrae. Now in the body and the lamina, the attachments are similar to the typical thoracic vertebrae. Now moving to the spine, at the tip there is the attachment of ligamentum nuchae and the muscles which are trapezius, rhomboidus minor, serratus posterior superior. These are the major muscles, and several other muscles that find attachment at the tip of the spine are splenius capitis, semispinalis thoracis, spinalis cervicis, interspinalis and multifidus. The transverse foramen on foramen transversarium transmits just the vertebral vein and sympathetic plexus of nerves. The vertebral artery, which was passing in the foramen transversarium up to the 6th cervical vertebrae, now passes in front of the transverse process. So it is related anteriorly to the transverse process of the 7th cervical vertebrae. Now the large posterior root, it gives attachment to suprapleural membrane. As we can see here, the anterior root, it is small, whereas the posterior root, it is large. Now this large posterior root is attached to the suprapleural membrane. Now another interesting fact about 7th cervical vertebra is that the anterior root, which is generally small, might sometimes enlarge and project anteriorly. Then it is known as the cervical rib. The costotransverse process or the costotransverse bar is partially deficit. Here you can find any clear-cut costotransverse bar, and the lower border, it provides attachment to the levator costarum. So here there will be the attachment of the levator costarum.